Hi, Kevin Sartin with Non-Master Physical Therapy with an educational video on FAI or Femoroacetabular Impingement. So what is FAI? Well, it's the impingement of your femur on the acetabulum as you move that femur around, if you move that joint around. And there's a couple different locations where this impingement can occur. So there's two different kinds. There's a cam deformity, and what that is whenever we develop some bone and some increased bone growth on our head or neck of the femur. This is more common in men. And then there's also a pincer deformity where we develop increased bone on the pelvic side of things, so on the acetabulum on the pelvic side, and that is more common in women. In the general population, FAI is about 10 to 15% of the population. There are some risk factors that make it more prevalent. So one can be genetics. So, if your parent had FAI, you are at a greater risk of having FAI as well. Other things are like if you have hip dysplasia, if you have a trauma to the hip, and then also athletes have also been found to be very likely to have FAI. It's been found that in male athletes, 50 to 75% of this population have FAI. And it's so common that lately, in recent years, it's actually no longer thought of as a deformity and rather just an adaptational change that the body goes through as we put different stresses on it, which athletes do. So with that being said, we got to find out, what's it present as? What's it like? So typically, FAI will be located in the front of the hip. It can occur in other areas as well, but more than likely it's going to be in the front of the hip, and you'll have hip pain with activities that involve hip flexion or bringing that leg upward. So this can be activities like cycling, if you're going around that movement multiple times. It can be with squatting, whenever we're decreasing the space there in the front, where that impingement or that increased bone is coming together. One quick thing that you can do, if you think you might have this, is just to do a squat test. So if you squat and, I got that pain right there, and you change the position of your feet, and you might have to play around with it a little bit, but if you rotate out and kind of open up a little bit, and then you're able to go down further with less or maybe even no pain, that would be one reason that I think about, maybe I have FAI. Is it a bad thing? No, not necessarily. What you want to do is kind of modify your movement. So instead of squatting or bending down in that plane, that stance, open things up a little bit. It's going to change where the bones of the femur and acetabulum are coming together and give you a better opportunity to have more motion and less pain. Treatment options for this. So let's say that maybe you do have this, but you're continuing to have pain, and it's affecting your life and your functional ability. So the first option, and it's a good one, is physical therapy. Okay, so it's very successful. So about 80 to 90% of folks who have PT for this condition, if it's a condition, it's considered a condition, are going to have symptom relief and improve function and not have to do anything else. So 80 to 90% success. You can also have some other treatment options such as pain medications. So you can be prescribed acetaminophen, Tylenol, or ibuprofen, NSAIDs. They can also do injections for this to help with short-term pain relief, whether it be corticosteroid injections or hyaluronic acid injections. Also PRP injections and stem cell injections are also considered, but not proven as much with research. And then, if these options do not work, if you're in that 10 to 20% that do not get relief with this, there is also a surgical intervention where they'll do an arthroscopy, go in, kind of shave off that excess bone, and then close you back up. So the success rate of that surgery is about 70 to 85%. So not super great, but also, successful in most folks. And then after that, you'll likely have physical therapy as well. But definitely with this condition, try to modify your activity, modify your movements, do PT if you're continuing to have pain. And then, if you're still having symptoms, go down the path to those other options. So I hope you found this video helpful. Please leave us a call or visit us at our website if you need anything. Thanks.